You wake up exhausted, your heart is racing, your body feels off, but the doctor says it's just stress, just hormones, just menopause. But what if it's not? What if there's something more happening? For too many women, heart disease is overlooked, misdiagnosed, or dismissed, and it's dangerous. We're breaking down the connection between menopause and heart disease because knowing the signs and trusting yourself can save your life. And don't forget to hit the subscribe button to get more real insights. Our guest today knows firsthand what it's like when your concerns about your health are ignored or dismissed. Carolyn Thomas is a journalist, author, and heart health advocate who turned her own misdiagnosed heart attack into a mission. She's the voice behind Heart Sisters and the author of A Woman's Guide to Living with Heart Disease, a book that gives women the tools to advocate for themselves. After being sent home from the ER with a misdiagnosis, she fought to uncover the truth, and now she's here to help other women do the same. Carolyn, welcome to the podcast. I am so excited about our conversation today.
Thank you for inviting me, Holly.
We're finally starting to hear more stories about women and heart attacks, and not just from the science, but from actual experiences. You've been one of the strongest voices in making sure that those stories are told. But today, I wanted to turn the spotlight on you and your experience. What was it like when you first realized that something was wrong, and what did you have to fight against to be taken seriously?
That's the key question, isn't it? I often say that nobody would be interested in interviewing me had I not been misdiagnosed in mid-heart attack and sent home from the emergency department. Had I been listened to and believed, you wouldn't be talking to me right now. So my first symptom were classic textbook Hollywood heart attack symptoms. I was out for a walk. I'm a very early riser, so I was out for an early morning walk, and suddenly, out of the blue, central chest pain, nausea, profuse sweating, and this pain down my left arm. And it was the pain down my left arm that frightened me. You'd think it would be the chest pain. I must have read or heard something about arm pain being a sign of a heart attack in women. At that time, I couldn't even take another step. Every step I took, the chest pain would be so severe. I leaned against a tree, and I remember my first thought was, as I'm leaning against my tree, was, this better not be a heart attack, because I do not have time for this today. Maybe tomorrow would be a better day, which turns out to be a very, very common reaction in women. In fact, there's a whole field of research called treatment-seeking delay behavior in women during a heart attack. I, though, made a good decision. My only good decision was on my walk, I had to walk past our hospital to get back home. And I worked at the same hospital. So I thought maybe I should just pop into Emerge and just mention this. And it was the arm pain that really drove me there. So when I got into Emerge, as soon as you say, I think I might be having a heart attack, first of all, I'm sorry to bother you, but I think I might be having a heart attack. Everything went into high gear. They did all of the diagnostic tests that any patient complaining of heart-related symptoms would get. All of my diagnostic tests came back normal. And I only learned much, much later that this also is very common in women heart patients. We'll have normal test results despite the fact that we are in the middle of a heart attack. When the doctor told me that I had acid reflux and that I should go and make an appointment with my family physician where I'll get a prescription for antacids. Goodbye and have a nice life. That was about the extent of his interest in me. But before I left, I was lying on a gurney in the back of emergency, and a nurse came out, an emergency department nurse came out, and she said to me very sternly, "You'll have to stop asking questions of the doctor. He is a very good doctor, and he does not like to be questioned." And she said it exactly in that tone. So here I am lying on the gurney with an IV in my arm, and this nurse is scolding me as if I'm a naughty child. But the really shocking thing to me was that I had only asked the doctor one question, and that was, what about this pain down my arm? Because I'm not a doctor, but even I knew that pain down your left arm is not a sign of indigestion. That was the only question I asked him. So my guess is he left my bedside and then said to his colleague, the emergency department nurse, oh, that pain in the neck in bed 8 is asking me these stupid questions. So she marches out and scolds me. I was so humiliated that I could not get out of there fast enough. So as soon as they took all the wires and leads off, I was out the door, feeling so embarrassed because I had just made a big fuss over nothing while all of the truly sick people were waiting behind me in line. And here I was wasting their very valuable time. So when the symptoms returned, which of course they did, there was no way I was going back to that emergency department. I did call my doctor. I had an appointment coming up in a couple of weeks with her. So I wasn't really alarmed, but all this time, I went back to work. I worked at that same hospital. I went back to work right away. I drove my car. I flew to Ottawa for my mother's 80th birthday, all while having these increasingly debilitating symptoms, which also convinced me that it wasn't a heart attack after all, because if I was having a heart attack, how could I be able to drive? How could I be able to go to work and make decisions? It made sense to me. Maybe that doctor, he was correct. Of course, it's just indigestion. And I am so stupid, I don't know the difference between indigestion and a heart attack.
Right, exactly. And
yeah.
the doctor, he must know what he's talking about.
Yes.
Okay, if I ask you how old you were when this occurred?
Yes, I was in my 50s. Which is considered young for a woman to have a heart attack. Men tend to get their heart attacks earlier, women a little bit later on. Some doctors believe this is because of the protection of estrogen before menopause. But I'll just finish up that story by saying I didn't go back to the emergency department for 2 weeks. And by now, the symptoms were really debilitating. I couldn't walk more than 5 steps without having to stop. And during this time, I'd flown to Ottawa for my mom's birthday, and I had to take a 5-hour flight back home to the west coast of Canada where I live. And I had 2 attacks on the plane, and at no time did I think I should call the flight attendant over. I knew if I told them, I think I'm having a heart attack, that they would probably turn the plane around because of a medical emergency. And I didn't want to be one of those passengers that forces them to do that because of indigestion. That would be so embarrassing.
And I'm sure that kept running through your mind what the doctor had said to you.
Of course, he's got the letters MD after his name. He knows what he's talking about. That was what I believed. But again, I didn't want to make a fuss. And I stress this when I tell my story because this is really common in women. We don't want to make a fuss. We're busy taking care of other people or other things or other events that are more important than whatever it is we're suffering now. And so we make excuses, we minimize our symptoms, we deny that we're having them. We go to emergency, and this is what the researchers are telling us. We minimize and then we self-diagnose. So we'll tell emergency doctors, for example, who are saying, chest pain, nausea, sweating, pain down your left arm, sounds cardiac to me. And we will argue with the doctors and we'll say, well, it's not really pain. I wouldn't really call it pain. It's more like just a pressure. So we minimize our symptoms and then we'll add things like, it could just be a pulled muscle because I was gardening yesterday and lifting heavy things. I bet that's all it is. So the more we talk that way to emergency staff, the more they think, doesn't sound cardiac anymore. You may not even get any tests ordered. So when I got to the airport and picked up my luggage, I got into my car and I drove myself home. So you can see, I always tell I do these free community presentations called Heart Smart Women. And I always tell my audiences, don't do anything that I did. Like just do what I say, don't do what I did. Because I was thinking, but I wasn't thinking straight. I blame that on lack of oxygen to my brain at the time. Because everything I did was focused on getting home. Luckily, it was very late. It was 1:30 or 2 in the morning. It was a very late flight. And there was hardly any traffic on the highway. Otherwise, I could have killed myself or somebody else. So
I'm
another,
still amazed that you were able to fly, get on a plane, get off a plane, and then
go to
drive a
work.
car. I just,
I know, I know. But this is the other reason that I wanted to believe that doctor, because in my mind, my stereotype of what a heart attack looks like, I didn't picture a person who could go to work and drive a car and fly to Ottawa. I pictured an old fat man at the golf course
Mhm.
who suddenly clutches his chest, falls down unconscious, sirens, CPR. That to me was a heart attack. And I was having none of that. I was totally functional in a kind of a weird way. It convinced me that the doctor was right and I had been wrong to think that it was a heart attack. So when I got home, I decided, and again, remember, I worked in this hospital. I worked with doctors and nurses. I'm not a doctor, I'm not a nurse, but I worked alongside them. And uh, every nurse will tell you, you never want to go to emergency at 2 in the morning. It's just not a place you want to be at that time of the day. And so I went home to wait for shift change. It was from 2 o'clock in the morning till about 7. And I flopped into bed with my coat and my boots on, and I just waited. I just waited and watched the clock, basically. Then I went to emerge. This time, I could tell by the looks on everyone's faces that something was very different this time. This time, though, they ordered all of the same diagnostic tests, and this time I was taken immediately upstairs. They called in a cardiologist who reviewed all of my test results. He came to my bedside and he said, I remember he held my hand with both of his hands, which was really touching to me. It was so sweet. And he said, Mrs. Thomas, I can tell by your T waves and all of your other cardiac diagnostic tests that you have significant heart disease. And I said to him, but how could that be? This very hospital sent me home 2 weeks ago, telling me that it definitely wasn't my heart. And then he explained to me how many of the diagnostic tests that we use still to this day have been researched and developed and designed for white middle-aged men, which means they work pretty well for white middle-aged men, but for women, they're often off the mark. I was immediately sent upstairs to the cath lab where a stainless steel stent was implanted into my left anterior coronary artery, which is one of the largest coronary arteries that feeds the heart muscle. When I was recovering in the CCU, which is the coronary intensive care unit for heart patients, every single person that I met, every cardiologist, every nurse asked me the same question. Do you have a family history of heart disease? Were you ever a smoker? Do you have diabetes?
did you think you were living a healthy lifestyle?
Yeah, I was. I'd been a distance runner for 19 years. I was almost vegetarian except for bacon.
Well, that goes
Really.
without saying.
I thought so, right up until I had my heart attack. In answer to your question, I did consider myself to be a healthy person because I'd had this 19-year history of distance running. But that also feeds into why we don't take it seriously.
What I find fascinating about that is the statistics on heart disease for women being the number one killer. And if that's true, why do women and even why do the doctors not think that that's a real possibility when you get to the emergency room or wherever?
Yes, exactly. And many times doctors will say, well, the symptoms were vague or they weren't typical. And I thought, how can our symptoms be called atypical when we represent more than 50% of the population? Even vague symptoms are typical of women if you're a woman having those symptoms. So often when I was at Mayo Clinic about 5 months after my heart attack, I was on the Mayo Clinic website, which, by the way, is a fantastic resource for heart patients and for any other patients. And there was a little sidebar on the screen, and it said, are you a woman living with heart disease? Apply now to attend the Women Heart Science and Leadership Symposium for Women with Heart Disease. And I thought, wow, I am going. I'm a woman with heart disease now. So I applied. I was the first Canadian that they'd ever accepted. So I felt kind of like being in the Olympics, representing my country at Mayo Clinic. But this was like a cardiology boot camp. And Mayo Clinic knew the cardiologists that were the faculty who taught this class for a week They knew that women don't take heart disease seriously. Women tend to believe that heart disease is a man's problem, not a woman's problem.
Okay, one of the dangers of heart disease, or one of the biggest dangers, isn't just the disease itself, but it's the misdiagnosis. How many times have you heard from women that their symptoms are maybe related to anxiety or stress, or, and I read this in your book, even menopause, which is a good dumping ground for all the things that are going wrong with a woman at this age?
Perfect. Yeah, if you're at the right age, it's probably menopause. Oh, I hear that all the time. Yeah, that's very common. 5 months after my heart attack, I applied and was accepted to attend a fantastic training program for women living with heart disease at Mayo Clinic. One of the things we learned there was the vast array of misdiagnoses in our little group. There were 45 of us, all women, aged 31 to 71, all of whom were living with heart disease. And I would say half of that group had been sent home from emergency or from their family physician. I saw women whose first heart attack symptoms were so weird that no doctor would be able to diagnose that as cardiac. For example, I met a woman whose only symptom was that her lips went numb. I met another woman whose only symptom was a persistent cough. Now, I can't even imagine any physician saying, lips went numb, it's probably a heart attack.
Right.
Because if you have a heart attack, especially in women, there's a concept called slow onset myocardial infarction, which means your symptoms can come and then they'll go away, and then they'll come back and then they'll go away. And that was why I was able to go to work, because I knew I was, sitting at my computer at work, and the symptoms would come back and I'd think, oh no, here they come again. And then within about 10 or 15 minutes, they'd go away. So I said, okay, back to work. We start believing that as soon as the symptom goes away, then you think, oh, glad that's over, whatever that was, and you don't take it seriously yourself. Here's my favorite example of what's called implicit bias in medicine. This applies not only to cardiology and heart patients, but every possible diagnosis. It's not a surprise that we're still being misdiagnosed and often undertreated even when appropriately diagnosed, because that's been going on for decades. Medicine is male-centric. There's an excellent book by Dr. Alison McGregor, who is an emergency physician, and she wrote a book called Male-Centric Medicine and Why It's Hurting Women. Because if all of your research dollars go into researching men, and there are many, many cardiac studies that included no women, or so few women that they couldn't make any conclusions about whether this drug worked or didn't work, whether this diagnostic tool worked or didn't work in women. If it worked in men, the assumption was it'll work for women too, and that's not true. The history of women's health care throughout history has been like this. This is 2025. Why is this happening?
Yes, why are we still having this conversation?
Exactly.
So based on what you said in that study, at least half of the women were misdiagnosed and being sent home. What advice do you give a woman who just knows that something isn't right? How do we use our voice when we know something is off? And our bodies don't lie to us. And I think as a
Exactly
woman,
right.
you know when something is just not right.
Yes. That's what I tell when I do my presentations. I always remind women, you know your body. You know when something is not right, just exactly as you said. And then you ask yourself, what would I do if this were my mom or my sister or my daughter who had these same symptoms? How would I respond to her? So if I had asked myself when I was in that plane with those horrific cardiac symptoms, what if it had been my daughter next to me in that plane with those symptoms? I wouldn't have been embarrassed about calling the flight attendant over. I would have been demanding that they turn that plane around so that my daughter could get help. And yet for myself, I just kind of, tried to, tough it out. So we will take care of other people, but not ourselves. Yes. And while I was at Mayo at our training program, they talked to us about a study on women's priorities. And they too are concerned about why are women taking significantly longer than men to seek help. this treatment-seeking delay behavior is far more often seen in women and not men. I met a woman at one of my talks who's had symptoms just like mine, really severe cardiac symptoms, textbook. And she must have looked horrible because her grown son was there. And he said, "Mom, I'm going to take you to Emerge right now." And she said, it was the morning of Christmas Eve. And she looked at her son and she said, "Honey, I've got 12 people coming for Christmas dinner tomorrow. I can't go to the hospital today." So in her mind, that made sense, right? It doesn't make sense at all to anybody else. And like my children thought I had turned into a crazy person when they were both out of town, living out of town at the time I had my heart attack. But when they got home after my heart attack to take care of me and also to yell at me, like my daughter said, "Don't ever do this to me again," because she was so worried. She just, was in a state because her mother almost died. So everybody who hears that you wait too long to see the doctor says the same thing. Why didn't you just go in? Why didn't you call your doctor? Well, I did go in, and the doctor, the person with the letters MD after his name, told me quite clearly, "It's not your heart."
Yeah, I mean, you walked past the hospital. You knew what the right thing to do was.
I did. Yeah.
I think there's another layer to this. And aside from the fact that women like to brush things off and we put 100 things ahead of us on the list, there's the emotional response to life. And you mentioned that in the book that sometimes if you go into the emergency room and you're, minimizing your symptoms, but you happen to mention that it might be related to anxiety or stress, that you would think that they would think it's a heart attack, but they also look at it as maybe you're just going through some emotional episode.
Absolutely. This is especially true with any mental health issue. So many women have told me that if you have the word anxiety on your medical chart, you can pretty well kiss a cardiac diagnosis goodbye. And if you're having a panic attack, a lot of people experiencing panic attacks do go to emergency because it does feel exactly like a heart attack. So it isn't until they get there and somebody says nothing wrong with you, and then they, like me, they go home embarrassed that they made a big fuss over nothing.
How do you speak up for yourself and not feel so like you did, so embarrassed taking these doctors at their word, because we shouldn't feel that way?
I know, absolutely. Now, I'll give you 3 little questions that I read about in a fantastic book called How Doctors Think. It's by Dr. Jerome Groopman, and he recommends these 3 little questions. If you hear a diagnosis that doesn't make sense to you, or you have a gut feeling, and no, I don't think it's anxiety, I don't think it's stress, you know your body. So the first question that he recommends is, what else could it be? What else could it be? And this stops, there's something called confirmation bias when in decision making among medical professionals. And if you think the first thing you think it might be, that's what you're going to stick to. Confirmation bias. This little question, what else could it be, kind of stops that thought process and makes the doctor think, well, could be this, could be that. The second question he recommends is there anything that doesn't fit here? Now, had I asked that question to my emergency physician, right away he would have said, well, the pain down your arm doesn't fit with acid reflux. Everybody would say that. So that's a really good question too. And the last one is, could I have more than one problem? Because it is possible to have an anxiety disorder and a heart attack at the same time. In fact, I always say there are a few things in life that are more anxiety producing than being in the middle of a freaking heart attack. It's normal to be very anxious when you are in the middle of a heart attack because you're so worried.
There was something else that I found really interesting in your book was that when you got home, I always assumed there would be so much more aftercare involved. But one of the things that stood out was depression.
Yes.
And not just because of the heart attack, but I also read that that's definitely a risk factor for women.
It is. Yes. Depression is kind of a two-edged sword. If you have a history of depression, you are statistically more likely to develop heart disease. And if you have heart disease, European studies showed that about 40% of women who have a cardiac event, like I did, will develop new onset depression. So that is not depression that I've lived with all my life. I've never had a depressive moment, really. And suddenly, I couldn't get out of bed in the morning, or I couldn't stop crying. And I was very afraid that my children would see me upset. And so I became really good at pasting on a little happy face around them all the time, which is exhausting when all you think of is, I'm probably going to, I became convinced that I was going to die in my sleep after I got home. Because this had happened to me, and I was still processing it, and it was so overwhelming. That's the other thing. It's so overwhelming. You're not thinking straight. It takes a while to kind of make sense out of something that makes no sense. And until I got that to that point, and sometimes I still am not there yet, I really believed that I was going to die overnight in my sleep. Crazy, crazy thinking, but that's where I was. It just made sense to me. And then when I went to my family doctor, and I had one really awful appointment where I was crying for the whole appointment. And I was so shocked that this was me. Like, I'm not the kind of person who cries at doctor's appointments. And yet here I am, and I can't seem to stop. And I asked her for a referral to a psychotherapist so that I could get some help. And her only response was, oh, there's a 1-year waiting list. And I said, 1 year? I'll be dead in a year. So she gave me a prescription for antidepressants, again, something I'd never taken before, but that's the sort of routine. You're depressed, here, try these. And they work very well for people, especially with severe depression. Less well for people who have what's called situational depression. I was depressed because something horrible had happened to me in my life. I couldn't make sense of it. I was having a lot of trouble dealing with this loss. Any serious medical diagnosis is a time of loss. You lose a lot of things. And there's a researcher in the States, Kathy Sharmas, and she talks about the loss of self, which is the biggest loss. After any kind of serious medical condition diagnosis, you could lose a lot of things. You could lose the ability for your body to move in the way it used to move, or the way you used to be able to do this, but now you can't do that anymore. But when you lose yourself, that is totally overwhelming because you've lost the person that you always thought you were, and you haven't yet substituted the new person that you're about to become. So that middle ground where you're trying to figure out what is going on here without help usually. Usually we do this on our own, which is why women smile and nod. And when people say, how are you doing? We say, oh, great, fine, thanks. But it's very isolating in a way that you didn't want to be isolated, because it's so exhausting to keep the happy face painted on in spite of the fact that you're feeling horrible. When I finally was referred, and I'm a person who highly values talk therapy, I think it's excellent. It really, really helped me. It was the only thing that helped me when I was going through that. Just somebody that I could talk through what I was going through, how it was feeling for me, how I was worried about my children and worried about so many other things. And then, of course, the whole thing about planning to die overnight. So I needed to get past that. And the only thing that helped me was that talk therapy. I don't want to make it sound like I'm not in favor of pharmaceuticals, especially if you have a severe depression or anxiety condition. They can be life-saving. So again, as women, we often are reluctant to try new meds, for example, because we don't want to be like those people who are on medication all the time, as if it's a sign of weakness, which it isn't. It's a sign that you need help, and you're giving yourself an opportunity to get the help.
I think it can be a combination of those things. Your doctor, your therapist, and maybe it is some type of medication, and putting yourself first.
Yep.
And I think it's definitely a combination of all of those things. Is there something that you changed afterwards in your lifestyle that you felt you were taking better care of yourself?
I think my diet improved a lot. For example, salt. there's no salt in my home anymore. And I was already very physically active. And I think I survived my heart attack because I had been physically active for those 19 years. I'm not a person who likes stuffy, sweaty gyms, but I love walking. I belong to a number of walking groups. So a lot of my schedule on my calendar now is meeting my friends for a walk, which does two things. It gets us outdoors, or sometimes we do a mall walk in the winter if it's pouring rain or really yucky out. But we also get the socializing, and then we go for coffee afterwards. So both of those things are so important because that's getting us back to real life. It's getting us out of our homes and out of our heads where we can have these, like AA groups call it stinking thinking. Things are bad now and they'll probably get worse. And once you start ruminating, that's very damaging to the coronary arteries too, because all of the stress hormones in your body, the cortisol, the adrenaline, the more we pay attention and the more we train our nervous systems to pay attention to what we're worried about, the harder it is to get better. And most of the time we're tricking our nervous system.
Right. That definitely makes sense. You've mentioned a lot of good books, and the Mayo Clinic is a resource. I'll make a little list for everybody, and I just want to say thank you so much for being here today and sharing your story, and definitely given the audience a lot to think about and a lot to be aware of. If we want to follow along on your journey, where's the best place to find you?
My blog is myheartsisters.org. And every Sunday morning, I publish a new article. I have over 900 articles.
Well, again, Carolyn, thank you so much for being here today. And I'm so glad that I came across your book and you had the time to speak with us. Thank you.
You're very welcome. Thanks for inviting me today.
Thank you for joining us on Real Insights. If you want to hear more about how other women manage their heart health and advocate for themselves, order your copy of Empart, Real Stories, Real Wisdom, Real Menopause on Amazon today. And don't forget to join the conversation at joinempart.com. Until next time, remember that menopause is a journey, but you're not alone.